Hi, I'm Justin Riley. Today on Wisconsin Doctors, we're on location at the Wildwood Family Clinic. They have two locations in the Madison area, one on the east side of Madison and a new one in Cottage Grove. We'll be learning about treating and preventing chronic diseases and conditions, and my guests will include Trisha Crinkly, who is a PA here at Wildwood Family Clinic, Stewart Mitchell, physical therapist at Wildwood, Dr. Christina Hook from the Family Medicine, and Dr. Robert Edwards. It's all coming up on Wisconsin Doctors on CW57. Stay right here. Welcome back to Wisconsin Doctors. We're here on location at the Wildwood Family Clinic here in Cottage Grove, and we're so excited to be here, and we're going to be talking about managing and treating and preventing chronic diseases. And my first guest is Trisha Crinkly PA here at Wildwood Family Clinic. Welcome, Trisha.
Thank you.
Good to have you here. So talk to us a little bit about Wildwood's prevention program known as health coaching, and how did it evolve?
Well, all family practice providers, doctors and PAs mid-levels, do what's called the annual exam, annual prevention exam. And the prevention part is to talk about, are you eating healthy? Are you exercising? How's your sleep? Are you managing stress? How's your diet? But what happens a lot is patients come in with kind of a laundry list of other things that they really want to talk about. This funny mole on their arm, headaches, hot flashes. So these are important things to talk about. We try very hard to deal with them. But all this other important stuff kind of gets pushed aside, and we sort of miss this opportunity. So we've all heard of the obesity epidemic, diabetes epidemic. We go to conferences about this a lot. So the Wildwood PAs about 3 years ago got together and thought, how can we do this better? And we came up with this idea of having a focused lifestyle counseling visit called health coaching, and that's what we've been doing the last 3 years, and I think it's gone really well.
Very cool, very cool.
Yeah.
Is there any special training that's needed? I mean, why PAs rather than dietitians or nurses?
Yeah, well, a couple reasons. I mean, as I said, I think PAs are well trained in prevention, but we're also generalists. So what happens a lot is people will come in and they'll have we have paperwork they fill out, a dietary log, a fitness assessment. We have them fill out an emotional eating questionnaire. And at that first visit, we may uncover, gosh, maybe there's some underlying anxiety that's really limiting what they can do, and we'd refer them to a counselor. Maybe there is some really significant dietary things that they should see a dietitian about. A gal I saw last week wanted to start exercising, and I felt she had a fair amount of cardiac risk, so I referred her to a cardiologist. So I think we're good at doing referrals if needed. But most of the time, you know, PAs can handle this. It's really about behavior change.
Trisha, are you seeing people that need more ideas on prevention of diseases or treatment ideas for existing conditions?
You know, kind of both. I mean, people with chronic health conditions like long-term diabetes and high blood pressure certainly can have benefit eating healthy and exercising. It helps their quality of life. I mean, can they really make huge enough changes to get off all their meds? Probably not, but quality of life, eating healthy, exercise is great for healthy aging. But the people I think we have the most success with are the people I call the pre-people. Pre-diabetes, pre-hypertension, pre-hyperlipidemia, high cholesterol. We've been watching their blood pressure numbers go up, their lipids go up, their glucose go up, and it comes to the point, you know, you might need meds if we don't intervene. And that's where I think health coaching can really make an impact. There was a study, and I'll be brief, there was a study that came out with 7% weight loss, 150 minutes of exercise a week. People at high risk for diabetes can prevent it. So it's super powerful medicine.
And at those pre-stages, it's really, I mean, there's still time. Obviously.
Yes, exactly. And they are so motivated and fired up, so that we really key in on that.
Yeah, absolutely.
Yeah, that's super exciting.
It is.
Trisha, we know there's a lot of confusing and conflicting information out there in the media about the best diet for folks.
Yeah.
In a nutshell, I know this is kind of a big topic, but in a nutshell, what do you recommend to patients you see?
Yeah, you mean, you're right. There's all these fad diets all the time. So what I first try to do is be aware of them, you know, what's going on with the paleo diet, the 5-2 diet. And when patients come in really fired up to do the paleo or some other diet, I want to get excited with them. I don't want to thwart them. I don't want to dismiss that. But I try to figure out, so what part of that diet do you think would be helpful for you? And so we try to look at the good part of the diets. With most great diets, eating less highly processed food is a good idea, so that can be helpful. The thing is, any restrictive diet, you can lose weight temporarily, but it's sort of boring and it's hard to maintain. So what we try to do is, what are you doing now? How can we just tweak what you're doing now and make it healthier? Because the patients are their own best experts. They know what they're able to do.
Yeah, absolutely. And really quickly before we go, I'm wondering if you can share with us a really great success story that you've had with a patient.
Yeah, so a patient of mine in his 30s, super highly stressed guy, came in December, and his life was really stressful at work and at home, and he had just really fallen off the wagon. He wasn't eating healthy, kind of vending machine lunches, not exercising. And so he came in and we did a workup, and his blood sugar was at the level of diabetes. I mean, we could have started him right then on meds. And so I remember talking to him, and he said, I am terrified of getting diabetes. My grandmother had it. She had lots of complications. What can I do? And wow, you can do a ton. We got him exercising back in his Taekwondo class with his buddies, also good stress management. We got him eating healthy again. And I kid you not, in 3 months, his numbers from diabetes went down to normal.
Awesome.
Wow.
That's awesome.
Pretty cool, huh?
So this is very doable. It's very preventable.
Yeah.
Even it's not too late if you get to that pre-stage.
Absolutely not.
Trisha Crinkly, thank you so much for the information today.
Thank you.
Don't go away. We've got more Wisconsin doctors coming up right after this. Welcome back to Wisconsin Doctors. We're here on location at the Wildwood Family Clinic here in Cottage Grove. And my next guest is Stewart Mitchell, physical therapist here at the Wildwood Family Clinic. Stewart, welcome.
Thank you very much.
Good to have you here.
It's good to be here.
So we're talking a little bit today about managing and preventing chronic diseases. What role can physical therapy play in the managing of chronic diseases?
Well, health and maintenance, exercise are so important for just sort of maintaining that proper body and even just joint health. So the more that physical therapists can get involved, we can kind of help people on that path. Usually it starts with getting a doctor's referral so that we can then start with a proper evaluation, assessing strengths, weaknesses, addressing the areas of chronic pain that someone has. And then to create an individualized exercise program that can address the patient's goals and get them back on the track that they want to do.
Absolutely. Yeah.
Stewart, if somebody has a chronic condition or chronic pain problem, how do they start an exercise program?
Right. The biggest thing that we want to do is we want to start slowly, start simply, and then kind of build up as you go. So it's kind of creating a baseline of exercises that are gentle, that don't create any more, sort of stress on the body, and that can, slowly build, create obtainable goals from there. And then the next thing is that once you have those obtainable goals, then we can kind of focus on not aggravating the symptoms, sort of, knowing your limits, and then, kind of working from there.
Very cool. Very cool.
Hey, Stewart, how does one maximize the results with their own exercise program?
Consistency is usually always the key. And so when you can have that consistent exercise program, you're just going to be able to just sort of slowly chip away at this. Now, with everything, there's going to be good days, there's going to be bad days. So with the good days, you want to maximize, kind of reach towards those goals. Bad days, pull back a little bit, focus on maybe those baseline exercises, but just sort of continually to exercise. Working on establishing a program of like a scheduled time to exercise, morning before you get distracted, working in through a particular TV program, exercising with a class, something like that.
Yeah, I have a follow-up question to that. I mean, you mentioned consistency, and it sounds to me like consistency supersedes rigor. I mean, these don't have to be rigorous exercises, running 10 miles every single day. These can be really simple things that you do, and as long as you do it on a regular basis, you're in pretty good shape, right?
Exactly. Yeah. So if you can just somehow kind of create that exercise program, you don't have to do something every day or like a huge program every day, but there's something that you can just sort of slide in throughout the day, and then you'll find that if you just work on a few minutes, those few minutes turn into more, turn into more.
Sure.
Then you don't have to necessarily plan out a half hour, but you'll find that sometimes you've been exercising for a half hour.
Yeah, and that sort of helps you develop sort of a foundation of good habits then, as far as
Correct.
exercising goes as well. So,
Yep.
yeah.
Is there kind of a psychological or mental component to maximizing success or achieving it?
Oh yeah. Very big one.
Yeah.
So with
That's
everything-
always a big one.
Yeah, it is.
And I find that if we can eliminate all the guilt of not exercising, that
Yeah,
helps
yeah.
a lot, quite a bit too. So it's not I have to exercise, I need to exercise, but more of I could exercise. Create more options sort of breaks down those barriers. The same thing is with all of the how much you can make it fun. So the more that you can make it fun, you can kind of exercise with friends, create a good social aspect of things, as well as do something you enjoy. If you like to be outdoors, do something outdoors. If you don't like the outdoors, do something indoors. If you like sports, focus on a sports-related thing.
Yeah.
Nice, thanks.
It really ought to be something that's fun. Exercise should be fun.
Yeah. This isn't something that you want to necessarily push your boundaries right away.
Right.
So you want to make it something that you can easily do, and it's not going to be as big of a stress.
Yeah.
Nice.
A lot of folks, they end up by terminating an exercise program because they get injured and they think, I can't do it anymore. How do you work with folks who've sustained injuries to continue an exercise program?
Injuries are always going to happen. It's any time that you'd have a consistent exercise program, you're going to get injured. And the biggest thing is that we want to make sure that we address what's at hand. Keep your physician involved. So if you need to go back to see your doctor, go back to see your doctor. But a lot of times we find that there's sort of compensations for compensation. So once you start to build past and get stronger for one compensation, you find that another thing has cropped up. Sometimes we end up sort of revealing the original injury that happened years ago, that now it's like, oh, I never knew that
Several
was...
injuries back.
Exactly, that's sort of driving the whole thing to get off track.
Yeah, very cool. Well, Stewart Mitchell, physical therapist here at Wildwood Family Clinic, thank you so much for joining us today.
Pleasure.
Don't go away, we have more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at the Wildwood Family Clinic here in Cottage Grove, and we're talking today about preventing and managing chronic diseases and conditions. And my next guest is Dr. Christina Hook. Dr. Hook, welcome to the program.
Thank you.
So you're going to be talking to us a little bit about preventing the complications of diabetes.
Yes.
First of all, we all know there's two types of diabetes, type 1 and type 2. But talk to us a little bit about the difference between type 1 and type 2 diabetes.
Diabetes is a condition of too much blood sugar in your bloodstream. Insulin is the hormone that we make to drive the insulin or drive the sugar into the cells and use it as fuel. Diabetes is a condition where that process is not working. And so in type 1 diabetes, which is usually seen in childhood, that's more of an autoimmune condition where there are antibodies that destroy the pancreas, that's the organ that makes the insulin, and cause it to not function anymore. And those patients need to be put on insulin right away.
Right.
Type 2 diabetes is most commonly seen in adulthood, although occasionally at younger ages, and that's more of a condition of insulin resistance. Your body's still making the insulin, but due to other factors in your body, it's not working as well as it should, and so that blood sugar keeps rising and keeps causing problems. And so that's more of a management of trying to control the factors that cause you to have excess blood sugar in the first place, and also medications and sometimes insulin to help lower the blood sugar through other ways.
Yeah, absolutely.
Dr. Hook, could you tell me more about the long-term complications that might arise from persons with diabetes?
All patients with diabetes, whether they're type 1 or type 2, run the long-term risk of complications. So it affects almost every organ in your body if left untreated. Starting from the eyes with blindness, it is a major risk factor for heart disease. It's as big of a risk factor for a heart attack as actually having had a previous heart attack. It can cause problems with blood vessels and vascular disease. Most people who have family members or friends with diabetes know of someone in their family, a grandmother, somebody who lost a toe or lost a leg, and that's usually a patient's worst fear with diabetes. It can cause kidney problems. It's the #1 cause of kidney failure in the United States. and it can cause nerve problems, damage to the ends of the nerves in your fingers and your toes most commonly, and that creates a condition called neuropathy, which leads to chronic pain, a burning sensation, and sometimes a decreased sensation in your feet, which can lead to more infections and other issues.
Yeah, something to be mindful of for sure.
Absolutely.
So, Christina, people with diabetes, why do we also put them on cholesterol-lowering meds?
As I said before, the biggest issue is that the risk for heart disease is so great when you have diabetes. And so even though the blood sugar is the technical definition of diabetes, first of all, blood sugar can get converted into fat if not used, and then that can cause problems with cholesterol. But also, we need to be as aggressive as possible about managing risk factors for heart disease. And so the guidelines that have just come out recently about managing cholesterol have recommended that all patients with diabetes that are on medication need to be on a cholesterol or a statin lowering medication, whether at a low dose or medium dose or a high dose, depending on what their cholesterol numbers are.
Yeah.
So Christina, why is it so important to have good blood pressure control in people with diabetes?
Blood pressure is another huge risk factor for heart disease, so that's one reason you want to make sure that the blood pressure is as well controlled to prevent heart attacks and strokes. But also blood pressure control is really important for the kidneys and making sure that the kidneys stay healthy and well perfused. And specifically, there's a class of medications called ACE inhibitors, which work directly on the kidneys and also seem to help protect the kidneys in patients with diabetes and help prevent excess protein from developing and getting out into the urine that causes damage to the kidneys as well.
Yeah. Oh, go ahead.
Oh, I was going to say, have you found patients do pretty well on those medications?
Most people tolerate them very well. I don't run into too many problems. We do have to monitor, as in any patient with diabetes, we have to monitor blood work periodically. And occasionally a cough can be one particular side effect, and then we can change them to another medication that may not have that side effect. But generally, these medications are very well tolerated.
And you mentioned, we just have a few seconds left, but you talked about type 2 diabetes and how there's certain factors that cause insulin to basically not be as effective. What are some of those factors that cause that to happen in type 2 diabetes?
Weight is by far the number one. Obesity and being overweight is a huge risk factor for adult onset diabetes. And so, I guess as Trisha had said earlier in the show, the studies are showing that exercising 30 minutes a day most days of the week and losing between 10 to 15 pounds can actually prevent you from getting diabetes or helping to control your numbers better.
Absolutely. Dr. Christina Hook, thank you so much for joining us today.
Thank you.
Don't go away. There's more Wisconsin Doctors coming up right after this. Welcome back to Wisconsin Doctors. We're here on location at the Wildwood Family Clinic here in Cottage Grove, and we're talking about preventing and managing chronic diseases and conditions today. And my next guest is Dr. Rob Edwards, and he's going to be talking to us a little bit about gut health. Rob, welcome to the program.
Thank you, Justin.
So good to have you here. So,
pleasure to be here.
Talk to us a little bit about why gut health is so important for our overall well-being.
Yeah, well, I provide integrative medicine consults at Wildwood Family Clinic, and I talk about gut health all the time. Gut health is obviously important to eliminate toxins and waste from our body. That's kind of an obvious thing. But the other thing that we don't talk about quite as much is the importance of gut health on the immune system. And this is something I cover time and time again. And it comes up quite often because one of the main therapeutic interventions we do in medicine is give antibiotics, which can disrupt the normal gut function. And sometimes I'll see that people are more prone to infection after that point. So we really have to spend some time and rebuild gut and gut health after those encounters.
Because you have those probiotics that really do help to prevent those diseases. And
correct.
Antibiotics eliminate those.
Exactly.
Yeah.
Exactly.
So Rob, what are some of the top supplements you recommend to promote the gut health?
Yeah, well, I was just thinking about this the other day. One is probiotics. This is probably the number one supplement that I recommend in my practice. During the integrated medicine consults, a lot of times we talk about the differences in the different kinds of probiotics, and we go through which ones might be the best for particular patients, but that's one of them. The second one is magnesium. And you know, Christina, you and I share patients. You probably see like every patient I see ends up on magnesium. And this is really why I have found it to be very helpful for good gut function. Finally, you know, there's probably about 20 that I can think of. But when I was thinking about this yesterday, I thought probably vitamin D. And you don't think about vitamin D as much for gut health. We think about it for bone health and maybe avoiding falls in elderly patients and that sort of thing. But I really do recommend vitamin D to help improve gut health.
Very, very interesting.
So Rob, what foods are good for gut health?
Breast milk. Surprising,
Wow.
right?
Yeah.
Well, breast milk is very, very important. And at Wildwood Family Clinic, we really do promote lactation and breastfeeding. In fact, out of all the clinics I've worked at, Wildwood by far does the best job at this. It turns out that our guts are developing really throughout our whole life, but most importantly over the first year. And breastfeeding and breast milk really promotes good gut health. Second to that, I would say fiber. And there are two main types of fiber: soluble, which is fiber that dissolves in water, and insoluble, fiber that does not dissolve in water, are probably the next most important type of food. You can get fiber from fruits and vegetables, nuts, seeds, grains. Whole grains are really good sources of fiber. Lentils, beans, legumes, that sort of thing.
Great.
Very good.
Thanks.
And as a follow-up, what kind of foods do you recommend avoiding?
Oh, that's a good question. You know, in general, I have been really talking about refined carbohydrates a lot. And these are white foods. You know, if it's white and colorless, generally it's going to be full of refined carbohydrates. That really seems to promote very limited different types of bacteria in your gut. And when you provide a more varied diet, plenty of fruits and vegetables, more whole grains and less refined carbohydrates, the bacteria in your gut really respond. And even without the probiotic supplementation, you can change what bacteria grow in your gut.
Very cool.
You can see a theme coming up over and
Yes.
over again.
Yeah.
Right?
And really quick before we go, obviously heartburn is a symptom of problems in the gut.
Yeah.
What are some things that we can do to manage heartburn? Is taking some of those medications that you see on TV okay?
Correct. Well, it can be, but I would say this is a conversation I have over and over again as well. I would say jumping right to the medications should not be our first line. And many times it is. What I talk to patients about a lot is how are they eating? Are they rushing? Are they overeating? Are they chewing their food? Are they helping out in preparation of the food? So really talking about how people are eating is very important with heartburn. And as far as some of the medications, you know, it is important that we talk about this a little bit more, and I try to avoid Prilosec if I can initially. Some people absolutely have to be on it, but for some people, there are other things we can do before we do Prilosec.
Absolutely. Dr. Rob Edwards, thank you so much for joining us today. I also want to thank my other guests, Trisha Crinkly, Stewart Mitchell, and Dr. Christina Hook. We have been here at Wildwood Family Clinic at Cottage Grove, and from all of us here at Wisconsin Doctors at CW57, we invite you to live longer, live better. We'll see you next time.